want to share some things with you today and tips that you can take back to your practices, because along the way there will be challenges and there will be roadblocks, and you will think to yourself, this is very difficult, this is too hard, this is more than what I bargained for. And along the way you will probably want to quit, but I will challenge you not to quit. Dentistry is a fabulous profession. And we, especially as a female dentist, we get to do so many wonderful things for patients, and we get to have that connection with patients every single day. But in these economic times, we need to have all the tips and tools that we can master so that we stay ahead of the curve. So successful people live in vision, and others live in circumstance. But at least if you have an idea in your mind of what you want the end result to be, then you can work towards that by attending CE, by reading books, by asking others, by having a mentor. The first thing leaders do is they have a clear vision. My vision for my practice is that I want to provide comprehensive dentistry to our patients. From that vision, then you can start putting the pieces of the puzzle together. It's very rewarding when you can set a child on a happy dental path for the rest of their life, because we see the adults that are 40 and 50 and 60 and that are scared to death. So if you want to be a better leader, what's your vision? Then what are your expectations? John Maxwell says this: if you are leading and no one is following, you're just out taking a walk. The best dentistry is the least dentistry. Patients get that. It's not an event. So as I'm becoming a better leader, my team's becoming better leaders. It's a continual process. That's what makes it fun. That's what's fun about dentistry. This is where anything that we can do along the way and early in the cycle to connect with patients becomes very, very valuable. So many dentists and so many teams could do so much more fabulous dentistry if they would just do the work up front, because I'm really passionate about photography. I think it's a good way to educate patients. I think it's a great way to do internal marketing. I think it's a great way to aid in treatment planning, case presentation, and of course a legal record. We actually have a hands-on course coming up in August and December in my office on the whole new patient experience, and we will spend 2 days with dentists, assistants, hygienists, and team members making your protocols, practicing photography, practicing impressions, practicing face posts, practicing that whole process, practicing the phone calls, so that then when you go back, you've got the systems, you've got the protocols, and now you can implement it. I want to tell you, every time in my practice, you can bank on it, take it to the bank. Every single time we take more photos, we do more dentistry, period. 3 P's of photography. The first thing you're going to do is prepare the patient. Mrs. Jones, would you mind if I take some photos of your teeth? I'd like Dr. Brown to see something closer, or I'd like Dr. Brown to evaluate this. It forces us to look past the teeth and look at the big picture. If you have, hard copies, if you have it electronic, it doesn't matter. The point is that you're showing the patient tools to help them understand where they are and what the possibilities are. So it is considering the patient's aesthetics. It's considering their function. It's considering their structure, their foundation. It's considering their biology. What's their periodontal health? But it's about showing the patient what's ideal and what's possible. And I challenge you to think like a leader and see that potential in the patient and give them the opportunity to say yes. And we ask questions and we listen when they answer those questions. And we try our best within reason to address that first. You open the door to the possibilities for the patient. It's about helping the patient be healthier, and that there's a body attached to those teeth and that mouth, and that we want their entire body to be healthy. So it is about personal ownership. It is about connecting the dots for patients. It is about being a more effective communicator so that they can say yes. And along the way, you're going to hit roadblocks. I did, you will. If you haven't already, you will. That's okay. Push through those roadblocks. There's energy on the other side of that roadblock. You can do it. It is worth it. You've got to try some things. Some things may not work. That's okay. Some things might. Stick with it. You'll find something that works. I hope that a lot of these ideas today will help you. It's about trying new things and being innovative and continuing to make a difference.